Hello Team Phoenix and welcome to my YouTube channel. This is your girl Catherine Minor. Please call me Kate Mimi. I'm a registered nurse from Kenya, working in the United Kingdom at the moment. Now guys, I know last time we discussed a little bit about breast cancer and I want us to talk more about something different about breast cancer today as well, okay? So sit back, relax and let's discuss this. Hey Team Phoenix, first of all, look, I have a Christmas sweater. Hey, I used to see these things in movies. You know, in Kenya, we don't celebrate Christmas the way they do it here in the United Kingdom. I don't know, complete with Christmas trees and Christmas sweaters. Okay, if you're well off, probably in Kenya you do. But coming from a background, the one I do, all we know is going for church, service, and then coming home, eating chapati. And maybe chicken. You know, that is a very wonderful time of the year, Christmas. But here, I have a Christmas sweater. Anyway, let's talk about breast cancer and the treatment that I'm on. Okay, so one of the things that happen is the breast cancer cells, when they are removed during surgery, they undergo very critical examination in a pathology laboratory. Okay, so what the doctors or the experts do is look at it under the microscope. What are the specific characteristics of this cancer? What is it going to respond to? So all the management, all the treatment that we have in the world, which one is it going to respond to? Are there things in the body of Catherine that are there and this cancer is utilizing it to grow? So that is what they did in my case. And guess what? They found out that indeed there was something about me that was encouraging the cancer to grow. And that is the female hormones. The female hormones are estrogen and progesterone. Everyone has them. Even men have them. Only that in men, they have very tiny amounts. And in some cases, they can have very high estrogen levels. Okay, the male hormone is called testosterone. So in women, testosterone is just a wee bit, and in men, estrogen, which is the main female hormone, is just a little bit. But then in the body of Catherine, just because she's a woman, she has this estrogen and progesterone, and the cancer were thriving on it. You know, think about a catalyst. These cancer cells were looking at my progesterone and my estrogen as the catalyst for them to grow. So they were growing and growing and growing without me knowing. Hey, bad news, Cindy. Now, what do we do when we discover that indeed this is what is happening? It is good news on one hand because we have a solution for it. And it is bad news on the other because the things that are making me female in the first place are what are working against me. Okay. So a solution had to be found, and the solution number one was actually being put on hormone blockers. So let us block these hormones for as long as possible so that these cancer cells, even if they ever think of being there or hiding anywhere in the body, they will never ever think of utilizing the estrogen and progesterone to thrive. Now, as you know, estrogen and progesterone are important in the body of a woman. Number one, even to carry a baby, we need estrogen, we need progesterone. Being a woman, having periods and all that, you rely on these hormones. So when we start taking these hormone blockers, number one, we are entering a period of menopause. Okay, I call it temporary menopause. I need to eat this. I call it temporary menopause. So you enter temporary menopause. By what I mean is you experience all the signs and symptoms of menopause. Number one is hot flashes. Oh my god, the hot flashes. You feel hot in your body. You know, it is cold, but you're like, my gosh, somebody give me a fan. That is what I've been experiencing. And I started experiencing it the first few days of taking that medication. It is called Tamoxifen. It is important that I put it out there. It is also used for other uses, I know that. But for now, let us just talk about it in the context of prevention of breast cancer. Now, studies have shown that if we take tamoxifen for 5 to 10 years, then the chances of the breast cancer recurring drastically reduce. Okay? So it is important that you take your medication. But now you are talking about the side effects. The other side effect that I experienced was actually bone pain. My goodness, the first few weeks I would be at work and suddenly I would feel like my lower back is coming up. It is separating, as if my pelvis is separating from my spine. Sometimes it is just tingling and numbness of my legs. It was just too much for me. And I remember I talked with my oncologist and I was like, Doc, do you think it is important for me to take this medication? I mean, talking about my specific case, what would happen if I don't take it because I cannot bear this anymore? And then the stomach upset, And then there is something else called moodiness. Oh my gosh, tamoxifen is associated with depression. You cannot tell me anything else. You are just moody for no particular reason. You feel like the world is shrinking and you're being constrained and nothing is ever going to work in your favor. Those feelings are there, and I really associate them with tamoxifen. So how do I cope, or what have I found that really works for me? Number one, one thing that I've found that works for me is timing of the medication. Hot flashes usually hit me at night, so I try and time my medication in about evening time, around 4 o'clock ish, to give it time, to hit me during the night before I fall into deep sleep, because sometimes I could wake up even at 3 a.m. with so much heat. I have to open the window and I'm so sleepy, but I'm so hot at the same time. I'm like opening the window and I'm so sleepy. My sleep just becomes very interrupted. The other thing that I have found that works for me, if the hot flashes are coming so much at night, you take the medication in the morning. Taking it in the morning means that the bane of the drug is going to hit you during the day when you're going about your business. I've done that and it has happened not once or twice. I remember taking walks sometimes and it was raining and the hot flash just decided to come upon me, and I removed my jacket, I removed my sweater, and everybody else, the motorists and the pedestrians, were warmly dressed. And you don't have a chance to explain to anyone that, hello, I'm having a hot flash here. Just move on with your life, isn't it? It tells you not to judge people when you see them dressing the way they are dressing, even if it is against what the weather says. Don't judge anybody because you don't know what they are dealing with. Okay. The other thing is about moodiness. My goodness, the feelings of sadness, the feeling of the cancer is not really over. What if it comes back? What if I'm really not healed? What if I really need to do chemotherapy? What if, there are so many what if. So how do I cope? Number one, I write. Writing for me is cathartic. I don't write for people. I write for myself. I write for myself to bleed out my emotions, to bleed out every negativity or positivity or whatever I'm feeling is constraining my mind. I write to bring it down, to just see it out on paper, to release it. Writing is a form of release for me. And then I also make such videos like the one I'm making today. It is because I want this out there, outside of myself. In fact, I don't watch videos after I've posted them on my YouTube channel. I don't watch them because I'm doing it for me and it has left me. That's it. The other thing I do is I've invested in walking and exercising. It really helps. And the other thing which has been very difficult for me is actually letting people in, letting people who are close to me know what I'm dealing with, letting people know that, by the way, I could be okay today and tomorrow I'm not okay, but that is my new normal. I'm sorry, but the girl that was there before cancer is not there anymore. I cannot pretend that I am going to have the kind of normal that I did. That will be lying. I remember even when I underwent counseling a while back, my shrink once said, there is nothing like going back to pre-traumatic normal. It does not exist. So it's my new normal to be fine one day and not fine the other day. It is my new normal to feel happy one time and unhappy the other time. It is my new normal. It does not mean that I'm not happy with my life the way it is. It does not mean that I'm questioning things. It does not mean that I am, now I want medication to help me regulate my moods or something like that. Not at all. It means that that's just me. That's That's the normal I have to deal with. And that is the normal probably you have to deal with. And probably you need to understand people who are dealing with cancer, especially fighters and survivors of breast cancer. Please do not think that they are okay all the time. Most of the time they feel drained. They feel like they have been wrung out of the juice that they had, and they just need time to rejuvenate. So allow them time. Be kind with them. Just hold their hand, because sometimes that's all they need. And don't discuss cancer all the time. Manze, we don't want to discuss this disease 24/7. Goodness me. Can we talk about something else? Don't ask me about how did I discover my lump. Hello, go and watch my YouTube channel. All I'm saying is we just want a normal life, just like everybody else. Do not treat us differently just because you had a diagnosis. If we are comfortable about talking about it, we are going to talk about it, okay? The other thing that has been helping me, the tingling and the numbness and tingling of my feet. I've been taking vitamin D supplements, largely because I'm in the United Kingdom, where the sun is as rare as cloves. The sun is quite rare, so my ability or my skin's ability to process or manufacture vitamin D is highly impaired. So I take vitamin D tablets. Besides that, what else I do is actually increase my intake of calcium. I take calcium supplements. I try to do that. I know probably it is not advisable, but then again, I look at my intake. My food intake has been horrendous because of low appetite and other things like that. So I try to up my intake of such supplements. I have read somewhere where doctors are recommending magnesium intake, and I don't have good data that can support that, so I would not recommend it for anybody, and I would not even go ahead and start taking magnesium tablets. So for me, it is working. Vitamin D and calcium supplements, that is what I'm taking, and it is helping me. It is helping me, and it is helping with the tingling and numbness of my feet. The other thing that really helps is actually exercise. So the more you move about, the more you're encouraging blood flow to the small vessels of the feet, and that way your numbness and your tingling sensation is going to go away. Finally, timing of the medication. Remember, this is medication you're taking for for about 5 years, and you're taking it daily at the same time. So sometimes you find yourself forgetting. Please don't panic. It is okay for you to forget. Do not panic at all. Just take it as soon as you remember. I've forgotten not once or twice, to be sincere. Sometimes I'm in the middle of something and I'm like, oh my God, my medication. So what I discovered is that I need an alarm. So I have an alarm on my phone that tells me, Kate, your medication, around the same time every day. Okay, so probably you want to do that. Some people have a medication dosette, which is just a little tablet. A little container where they put ignore this, but it looks like this. Okay, it is a little container that has 1, 2, 3, 4, 5, 6, 7 compartments, 7 days of the week. So you put medication for every week, such that if you think you have forgotten, you can always go and check, is that dosette empty, is that compartment empty. If it is empty, it means you took your medication. Okay, those are some of the things that I have found that works for me. The other thing is staying hydrated. You really need to stay hydrated. Stay hydrated. Drink a lot of water. For your kidneys, for your body, you need it. Because the other thing is, if you're dehydrated, you can also be very moody. If you're dehydrated, you are denying blood flow to your brain. You can be very depressed as well. So it is important for you to stay hydrated. So those are some of the things that I found that work for me. I know it's a journey. 5 years is not 2 days. 5 years of taking the same medication every day at the same time is not easy, but it has to be done. I know there are people who are taking other medications for the rest of their lives, and I gain courage, I gain encouragement from such people, knowing that it's just for a while. It's just for a while, and it is for a good cause. I do not know whether indeed stopping this medication before 5 years is beneficial. There is a very big trial that is continuing at the moment, and I think it will be done in 2025 if I'm not wrong, that is actually assessing the effects of stopping tamoxifen and the other anastrozole and such other medication, stopping this medication before 5 years or before 10 years, depending on how many years the doctor has prescribed them. And they are trying to see what is the effect. But before we find out, we just follow the rules, don't we? We just do what we are supposed to do, and we continue being alive, being happy, and doing everything that we can. Tamoxifen or no tamoxifen, life is for the living. So thank you guys for watching and indulging me. So until next time, Merry Christmas.